And good afternoon to the viewers at home. What happened is that my aunt was first admitted to one of the hospitals, I think Grey Hospitals, at the beginning of April, because she had other underlying complications. For example, we knew she had hypertension and other illnesses that usually old people suffer from. So when we took her to hospital, she had breathing difficulties. So the hospital immediately flagged her as a COVID-19 potential client, or they suspected that she might have COVID-19. And then they, at that time, did not isolate her, but they ran a test. But then immediately decided to discharge her to say they wanted to, I think, disinfect the hospital or something like that. Sent her home, conducted a test. No one was told when they received the results, I think on the 20th of April, that the results were positive. So my cousin brother, who is my aunt's son, kept on taking his mother, obviously, to different healthcare institutions in the province, trying to get help because her situation was not improved. It was only at the time when she was admitted to SABC Hospital early in May that the family was made known that she had tested positive on the 20th of April. But the strange thing about it is that on the 30th of April, another test was done, and she tested negative, right? But then SABC Hospital still continued to self-isolate her, even though I suppose as a precautionary measure. But then, unfortunately, because she tested negative, she was isolated, and then health workers at the time at SABC Hospital were protesting because they were saying they don't have personal protective equipment, as is the case now, as I heard in the background story. Of what's happening, for example, at the Nelson Mandela Bay Metro. It's exactly the same thing that happened at SABC Hospital. And for that reason, my aunt did not receive, there was no one who could really attend to her. So she was left in that room to die on her own. There are new developments and new revelations that have come to light. I was called in the morning today about issues that we might have to consider, things that we did not know about before her passing. But the critical issue here is that another test was done on the 3rd before she passed away on the 4th. And the results of that came through to us on Friday, which says again she was negative. She didn't have COVID-19, she wasn't positive. I was advised by the MEC of Health in the Eastern Cape at the time when we were trying to find that information to say my aunt was told at Grey Hospital that she tested positive. But when we spoke to the doctor from Grey Hospital, he said, no, I had never had time to actually view the results. So I would not have been in a position to communicate those results, the ones that were done on the 20th, which means both the family and my aunt never knew that she tested positive at some point. And as a result, we never took any precautionary measures because we thought we were dealing with her normal day-to-day illnesses that we usually know how to deal with. Mm-hmm. So it's negligence on the part of the people who were dealing with my aunt at the time, on the part of the people who are dealing with other similar patients at Grey Hospital, perhaps even at Bishop Hospital, and how the matter was dealt and handled at SABC Hospital. And it is precisely that I requested on behalf of the families to say that at least the provincial government must do a proper investigation, not only of my aunt's case, but of other similar cases, because we hear of similar complaints from other people who have not at this point in time necessarily escalated the complaints to the relevant authorities. I have personally encouraged people to do so that we can be able to nip the challenge in the bud, to be able to unearth all these weaknesses, the loopholes that exist in the system. But the fact of the matter is, there is a problem in the Eastern Cape, in particular, at this point in time, insofar as being able to handle COVID-19 and to be able to respond and to curb the spread of the virus.
So you've raised many areas of concern, particularly in the Eastern Cape, and of course with your position, not just as a nephew, but you're the UDM Deputy President and a Member of Parliament. Some may assume that you've got more access to officials and are able to have your concerns raised and heard and dealt with more quickly. What do the areas of concern mean for people who don't have that quick access to power, and what are you going to try and do to assist that, not just with this incident, but on a broader scale?
That's why I commended the Premier for his swift response, but not only that, for agreeing with my recommendation that this needs to be brought. Remember, we brought this thing to the attention of the public because of the danger of this one incident posed to the residents of the province. But we're also worried that this might not be an isolated incident. I'm of the view that many people have actually suffered a similar fate, but they haven't raised the issue. So it's an opportunity now for the province to do a proper investigation. I'm glad that the Premier has actually referred the matter to the Health Ombudsman. We have written a letter not only to the Premier, but we've copied the Health Ombudsman to say that we are willing to avail ourselves for the investigation. And now we have managed to identify people who are able to testify as witnesses to provide evidence to the Health Ombudsman with the investigation so that it can be expedited, because we don't have the luxury of time, especially when it comes to matters and cases that have to do with COVID-19. We have to nip whatever problems are in the bud so that we prevent unnecessary loss of lives.
Mm-hmm. Our colleague Lerato Fikisi was telling us a few weeks back about medical staff writing to the SABC to ask for help in terms of highlighting their lack of personal protective equipment. We've also just seen that report of health workers protesting today, and that also critical posts in the Eastern Cape are not being filled. So the challenges and failures of systemic neglect in the Eastern Cape and many parts of South Africa are compounding the COVID-19 situation.
Correct.
Is it possible to fix this, and how long will it take practically? What needs to be done?
It's that issue. For example, one of the things I did immediately after I wrote the letter to the Premier and copied the Minister of Health was to immediately call on Mr. Fultane, who is one of our MPLs and happens to also be the party leader for the UDM in that province, to say all of these issues that have to do with personal protective equipment, for example, and all the other complaints that we receive, especially from healthcare workers, we must make it possible for the health workers to escalate those complaints and those concerns, particularly at the provincial level, to those public representatives who can then be able to use the weekly meetings that they apparently have with the Premier and other members of the executive in the province to actually highlight these issues, flag these issues, so that if it's a resource issue, if it's a resource constraint issue, we are able to make decisive interventions and even appeal to national government to avail more resources, which is the National Health Department, to provide more support to provincial departments. Mm-hmm. Where at this point in time, because it's difficult at this point in time to be able to tell us exactly what is the problem. Is it a leadership failure problem? Is it a resource constraint problem? Is it management at institutional level? What is it? And up until we're able to put our finger on what the issues are, we will not be able to actually provide recommendations. But I'm glad because Mr. Fultane is working closely with other leaders in the province, in the provincial legislature, to actually try and identify these issues and come up with recommendations as soon as possible.
Thanks so much for your time on SABC News. Nqabayomzi Kwankwa joining us on the line in his capacity as the nephew of Nomathamsanqa Banzi, who passed away. There have been those concerns raised, and we know that the Eastern Cape Premier is asking the Health Ombudsman to conduct an independent investigation that's not tainted by the interest of trying to protect government. We will be following that story as SABC News for you.